By the time you finish this section on 65G-7.004, you should know what you need to do to become a Medication Assistance Provider, a MAP, and how to maintain your status, the rules that unlicensed people must follow to be able to supervise the self-administration or administration of medication to individuals with disabilities receiving services from APD, the requirement to pass basic medication administration training and prescribed Ntral formula administration training courses, and the initial and renewal requirements for both of the aforementioned courses. So, who may help an APD client with their medication? I mentioned earlier that friends and family members are able to help people with their medication. Did you realize there's a law that gives family members the ability to help sick loved ones with all kinds of things that generally only licensed people would do? You would be amazed at the things families are trained to do. Well, included in the law is the ability to help with medications. But remember that APD rules require that a friend or family member that is helping an APD client must not be paid for providing this assistance. Of course, licensed healthcare providers whose license permits the administration of medications may help, but there are rules and regulations they must follow. The law also allows unlicensed direct service providers to help if they have met the requirements to become a medication assistance provider. MAPs who have successfully completed the APD-approved Basic Medication Administration training course and have current validation for the specific route of the medication that is to be administered are authorized under the law to assist APD clients. In the past, if a direct service provider needed to give a person their formula feedings through a gastric tube, all that was necessary was for them to be trained how to do it. One of the major changes in the 65G7 rules deal with the administration of prescribed Ntral formula. If you were previously trained to give tube feedings, you have until December 31st, 2019 to obtain the necessary training and validation. Beginning January 1st, 2020, you will no longer be permitted to give tube feedings if you have not met the requirements that we're going to talk about next. Just like medications, giving a family member or friend their tube feeding is permitted as long as you're not being paid. Most of the time before the person goes home after the tube is inserted, the nurse will teach the family how to take care of the gastric tube and do the feedings. For you to be authorized to administer prescribed formula through a feeding tube, you must be authorized as an MAP, which means you have successfully completed the training and are validated. You must successfully complete the prescribed Ntral formula administration training course taught by an approved APD trainer, and you must be validated for the administration of prescribed Ntral formula by an APD-approved validation trainer. As with basic medication administration, you are required to validate your skills every year. If you allow your validation to expire, you will not be able to administer formula by the Ntral route until you retake the prescribed Ntral formula course and have obtained your validation. The steps to become an MAP are straightforward. You must complete an APD-approved Basic Medication Administration training course from an APD-approved trainer and be validated for the routes you will be either supervising or administering. Part of the initial training is receiving validation through simulation for the topical, transdermal, and otic routes. Since we are web-based, you don't have the opportunity to do this part since your training is online. Because of this situation, 65G7 has a rule for that. If no opportunity for simulation is available during the training, for instance, web-based online course, you may obtain on-site validation from the validation trainer either by simulation or with an actual client using his or her medication for the route at the time it is scheduled. As a side note, a list of available validation trainers may be obtained from the Medical Case Manager, MCM, working in the regional APD office in your area. You can find the contact information and phone number for your region on the apdcares.org website. I want to point out that Ellie is on this slide, so write this down. The final exam has two parts. The course content portion requires a score of at least 85% to pass, and the MAR exam, which requires 100% to pass. There are other rules concerning the final exam that you will need to know. First, you must complete both parts of the final exam within 3 calendar days of completing the Basic Medication Administration training course, or you will be required to retake the course. In the case of MedEd America's online course, I will deem the coursework completed as the date you pass the checkpoint for Module 5. If you don't pass the exam, you are allowed to retake the exam once for each part, the content portion and the MAR portion. If you are unable to obtain a passing score with a retake, you will be required to take the course again. For you to be authorized to administer prescribed Ntral formula, you must be authorized as an MAP for the administration or supervision of self-administration of medication, and you must complete an APD-approved prescribed Ntral formula administration training course. Your instructor must be an APD-approved for a prescribed Ntral formula administration training. The prescribed Ntral formula administration training has a two-part APD-approved exam also. You must pass the contents section with at least 85% and have 100% accuracy on the simulated return demonstration. If you don't pass the first time, you may retake the exam once. If you don't pass the second time, you will need to retake the course before you can attempt the exam again. The MCM at your regional office will have a list of available trainers. Remember, trainers will have a certificate and a trainer number for each of the courses they are permitted to teach. In the next slides, we'll be talking about the validation requirements, what the requirements are, what you will need to do, who can validate you, how to find a validation trainer, what you need to do to maintain your validation status. During a live class, or with your initial validation when you complete the online class, you will be validated for the otic, transdermal, and topical routes. You will not need to revalidate for these routes unless you let your primary route expire. Your primary route will always either be oral or Ntral, and the validation trainer will circle the route on your validation certificate. If the provider you are working with doesn't have a validation trainer they normally work with, a list of approved validation trainers may be obtained from the regional office MCM. The next 10 slides have Ellie, so please either write the information down on your worksheet or make notes. First, we will go over some rules. Then I will tell you what you're required to know to pass your validation. There is a specific and separate validation required for prescribed Ntral formula administration, in addition to the validation needed for basic medication administration. Remember, an approved validation trainer must perform all validations. You must achieve a score of 100% proficiency in the validation before you are approved to provide medication assistance or prescribed Ntral formula administration. You must also be validated for your primary route within 180 days of completing the medication administration training. This includes basic medication administration training and prescribed Ntral formula training. Basic medication administration proficiencies. There are 11 proficiencies you must be able to demonstrate for your initial validation. We are going to review them now. Again, write them down. There's a place on your worksheet. These are the things that are listed on the validation certificate for the validation trainer to check off when your initial validation is completed. If you add additional routes later, all you will need to do is demonstrate how to give the medication using proper technique and in a safe and sanitary manner. 1. You must be able to comprehend and follow instructions on a prescription label, doctor's order, and accurately complete a MAR form. 2. You must be able to administer medication by the oral, transdermal, ophthalmic, otic, rectal, Ntral, inhaled, or topical administration routes. 3. You must be able to find medical information, including the reason the medication is being given, common side effects, symptoms of adverse reactions to the medication. 4. You must be able to write neatly and clearly, be able to give accurate information, communicate clearly in writing to ensure the health, safety, and well-being of the client. 5. Follow all medication administration record-keeping rules. 6. Communicate in a manner that permits healthcare providers and emergency responders to adequately and quickly respond to emergencies. 7. Know the proper way to store and handle medications. 8. Know how to properly dispose of expired or unused medications. 9. Know the special requirements for storage, documentation, and disposal of controlled medications. 10. Know that you must have an authorization for medication administration form and an informed consent for medication administration assistance form before you provide medication assistance. And 11. Know the correct positioning and use of any adaptive equipment or use of special techniques for the proper administration of the medication. Prescribed Ntral formula administration proficiencies. The validation process for prescribed Ntral formula administration includes demonstrating the 6 following proficiencies. 1. You must be able to comprehend and follow the prescribed Ntral formula instructions on a doctor's order and properly complete a MAR form. 2. You must be able to administer prescribed Ntral formula by the Ntral administration route. 3. You must be able to write clearly and neatly, give accurate information, and follow all of the medication administration record-keeping requirements. 4. You must be able to communicate in a manner that permits healthcare providers and emergency responders to adequately and quickly respond to emergencies. 5. You must know how to store and handle prescribed Ntral formulas properly. And 6. You must know and use correct positioning of the person, know how to use any adaptive equipment needed, or the use of special techniques required for the proper administration of prescribed Ntral formulas. Validation for additional non-primary routes. You may not always be required to validate for all of the routes you will be permitted to supervise or administer following your training. Remember, except for the topical, transdermal, and otic routes, which are generally validated through simulation, you can only demonstrate your skills to the validation trainer when a client has a medication scheduled for that route. For this reason, you may find that you will need to validate for additional routes at some time after you've completed the initial validation. To validate for an additional route, you will need to make an appointment with a validation trainer for a time that the medication for the route you are adding is due. Be sure to bring the original validation certificate that you were issued when you completed the basic medication administration training course. Be sure the validation trainer documents your validation on the original certificate. You are responsible for keeping all the original forms and certificates. This includes a copy of your certificate of completion for the basic medication administration training course, the original basic medication administration validation certificate, all of the original validation renewal certificates, and all of the certificates that show you have completed the annual 2-hour in-service training. Always put copies at the client's residence and give copies to your employer or the provider you are contracting with for your personnel file. I recommend that you get a binder with sheet protectors and keep all of your originals in that binder. If you lose them or can't produce them at APD's request, you may be required to retake the initial training and validate before you can continue to provide medication assistance provider services. Maintaining your MAP status for basic medication administration. Earlier, I briefly mentioned the mandatory 2-hour in-service training for medication administration annual update training. This is a key in maintaining your MAP status. You must complete this update before your expiration and revalidation. The other requirement is to revalidate your primary route before your validation certificate expires. You should also revalidate for any other routes you are currently providing assistance or supervision for your client or clients. Be sure to remember to bring a copy of your certificate of completion for the Basic Administration Annual Update to show your validation trainer. As long as you do not let your primary validation expire, you will not need to revalidate for the topical, transdermal, or otic routes. The validation trainer will transfer the date from your current validation certificate to the new one. One of the things I have the people I validate do before they leave is pull up the calendar on their phone. I have them go 1 year from the date of their validation, then go back 2 months or 60 days. For instance, if they are validating on July 1st, 2019, I have them go to May 1st of 2020 and put a note to themselves that they need to be sure the 2-hour in-service is done, then they can validate at any time. Then I have them go 1 year and 1 day from their validation date. So in our example, that would be July 2nd, 2020. On that date, I tell them to put a poop emoji and a crying emoji, because when they realize they have not revalidated by that date, the first thing they will say is, "Oh, first emoji," then they will look like the other emoji. I'm sure you're asking why I say that. The reason is that if you allow your primary route to expire, you will be required to retake the basic medication administration training course and get validated before you can provide MAP services for your client or clients. FYI, if your digital calendar will allow you to repeat it, you may do that, because as long as you keep your primary route validation current, your expiration day and month will stay the same. All of the different dates you may find on your validation certificate can get a little confusing, so we are going to take a minute to go over them. The effective date for otic, transdermal, and topical routes is the date the MAP successfully completed the initial validation by either simulation or with an actual client. These routes do not expire unless the primary route expires. The effective date for the primary route is the date you successfully complete the initial validation for the primary route. The expiration for the certificate and subsequent renewal dates are based on this date, and it's 1 year from the validation date. The effective date for a non-primary route is the most recent validation date for that route, and it expires 1 year from its effective date. This date may also need to be brought forward on your new validation certificate if it expires after the current expiration date of the primary route. But remember, you will need to renew the validation for the non-primary route if you are still giving it. A good rule of thumb is to renew at the same time you do your primary route validation if your client or clients still require services for that route. It just makes it easier to keep all of your dates straight, and you'll never have to worry about a lapse in validation for the non-primary route. Okay, let's do a quick recap of the revalidation requirements. At least annually, you must, through demonstration, 1. Administer or supervise the self-administration of medication. 2. Administer prescribed Ntral formula. Remember, this is in addition to revalidation for basic medication administration. 3. Revalidation must be completed within 60 days preceding the expiration of the current validation certificate. Warning: if your primary route is allowed to expire, all routes expire, and you are no longer permitted to assist with any route until you have completed the 6-hour course and have revalidated for all of the appropriate routes. Note, you must have your certificate of completion for the annual update to present to the validation trainer in order to be revalidated. Revalidation for prescribed Ntral formula administration. Like the basic medication administration revalidation, you must complete your annual update training and revalidate before your validation certificate expires. Be sure you have your certificate of completion available for your validation trainer's inspection. Should you allow your validation to expire, you may not administer prescribed Ntral formula until you retake the training course and have been validated. Warning: you must revalidate for your primary non-simulated medication administration within 60 days of completing the update training for basic medication administration and prescribed Ntral formula. Remember, first, you are only permitted to administer or supervise routes for which you have a current active validation. Second, if you allow your primary route to expire, you may not supervise or administer medication by any route, even if the non-primary is not expired. You must take the basic medication administration course and be validated before you may resume your medication assistance duties. Third, if a client is prescribed a new medication that is administered by a route you are not validated for, you should notify your supervisor to attempt to contact an MAP who can administer the medication until you are validated for the new route. Under certain circumstances, you may receive a temporary validation. In a situation where your client is prescribed a medication for a route that you are not validated, you may receive a temporary validation for that specific client and that specific route. However, there are some rules, and the temporary validation is only allowed under the following circumstances. The medication is necessary to ensure the health and safety of the client. The provider was unable to contact an MAP which is able to administer to the route at the appropriate dosage times. The MAP that receives the temporary validation obtains validation for the route by an approved validation trainer as soon as possible within a 30-day period. The doctor or nurse that issues the temporary validation must use the temporary validation form provided by APD or their letterhead. I recommend that you always keep a copy of the temporary validation form so that you will have it available if you need it. If the doctor or nurse uses their letterhead, it must include the following information. The doctor or physician validated the MAP, the date of the validation, the route of administration validated, the length of time the validation is necessary in order to ensure the client obtains the medication as prescribed, and provide time for the MAP to be validated by an approved validation trainer, or locate an MAP who is validated in the appropriate route. A temporary validation can last no longer than 30 days. Again, I encourage you to always be sure you have a temporary validation form with you when you go to a doctor's appointment with your client. It is a quicker and easier way to complete the documentation requirements we just discussed. You will also be sure you have all the required information. In addition, if you don't have the form and the doctor does use letterhead for your temporary validation, you are required to attach the APD temporary validation form to the letterhead. Another restriction is that temporary validation is only good for the following routes: oral, Ntral, medication, no prescribed Ntral formula, transdermal, ophthalmic, otic, rectal, inhaled, and topical. Again, temporary validation is not available for prescribed Ntral formula. You must take the course and be validated. Completed temporary validation forms must be maintained by both you, the MAP, and your employer, and must be available for APD review upon request. Just a few more things and we'll be finished with this section. Some of the information you've already seen. Once you have been trained and validated on one nebulizer or intermittent positive pressure breathing IPPB machine, you will not need to retrain for the same type to qualify as validated for nebulizer or IPPB machines. You must keep all the original certificates, including the certificate of completion for the training, all validation certificates. Employers of MAPs must maintain copies of all of your training certificates and proof of current validation for each employee providing medication administration assistance at the site where the medication administration assistance is being provided. Your employer must also maintain copies of your training certificates and annual validations and make them available for APD review upon request. It has been an extremely hectic day. 2 of the MAPs scheduled to work called in sick, and you are the only direct service provider that is certified as an MAP. There is no way you can pass all of the new medications by yourself, even if you start at 11 a.m. Peter and Jacob, the new hires that are working with you, have completed the basic medication administration training and will be validated at 6 p.m. tonight. They offered to help you since they're trained and all they need to do is show the validation trainer they know how to give someone a pill. What should you do? Perfect. Unlicensed direct service providers must successfully complete the basic medication administration training course and be currently validated for the specific routes that are to be administered to or supervised. Remember, if you allow your primary route to expire, you may not administer or supervise any route until you retake the basic medication administration training course and have been validated for the specific route or routes. I'm sorry, your answer is incorrect. Unlicensed direct service providers must successfully complete the basic medication administration training course and be currently validated for the specific routes that are to be administered to or supervised. Remember, if you allow your primary route to expire, you may not administer or supervise any route until you retake the basic medication administration training course and have been validated for the specific route or routes.